one of the main strengths of the AI models that we build is that they can do forecasting or predicting what could happen in the future within certain windows. So for clinical deterioration, for example, we usually predict if a patient would deteriorate in the next 24 hours, 48 hours, 72 hours. So the time windows are also predefined. And I think these kinds of tools can help in identifying patients who are at higher risk than others, so that they can assign more resources. Maybe they can increase the frequency of checking in on the patient. And this way they can then avoid some of these adverse outcomes. Now, there's some related research that looks at actually the impact of early warning models, because it's also tied to human factors research and other kinds of sort of medical research that pertains to how to actually implement those models in practice and act accordingly. So whether or not they would achieve a positive impact also requires more prospective studies that look at deploying those models in practice and seeing how they would actually affect patient outcomes in the long term. I think one of the most exciting projects that we built on recently has to do with multimodal learning and multimodal fusion. So in one of our recent papers called MedFuse, we actually proposed a framework and a data repository, an open source code for researchers to build models that can use chest x-rays and electronic health records. We're currently scaling that up and trying to publicize a new benchmark that actually incorporates other kinds of tasks. And we hope that through open source tools and resources, the research community can maybe garner some interest in this area and advance it.